What's up guys, Vimal Thomas here. Welcome back to another video. Today we are doing the anatomy of liver. So the objectives of today's video are introduction, functions, surfaces of the liver, ligaments of liver, lobes of liver, blood supply and lymphatic drainage of the liver. So as an introduction, it is a peritoneal organ. It is located on the right side, right upper quadrant of abdomen. It is the largest visceral structure on the abdomen, and it is the largest gland in the body. Second one is the function. The functions of the liver are the storage of glycogen, production of clotting factor, and bile synthesis. Next one we have the surface. The liver has two surfaces. There is a diaphragmatic surface and there is a visceral surface. The diaphragmatic surface is anterior superior surface of the liver. It's the anterior surface of the liver. It's smooth, convex and located beneath the curvature of diaphragm. And posterior aspect of this diaphragmatic surface is not covered by visceral peritoneum. So because of that, this area is also known as bare area of liver. The visceral surface, it is found in the posterior inferior surface of the liver. Except for fossa of gallbladder and porta hepatis, rest everything is covered by peritoneum. It is molded in the shape of the organs surrounding it. It has an irregular or flat shape. It lies in contact with right kidney, right adrenal gland, right colic flexure, transverse colon, first part of duodenum, gallbladder, stomach, etc. The next objective is ligaments. So we have two types of ligaments, two classes of ligaments. The first one is the ligament of liver in respect to organs, and second one ligament of liver in respect to the walls of abdominal cavity. So in respect to organs, we have two ligaments. We have hepatoduodenal ligament and hepatogastric ligament. Hepatoduodenal ligament is a connection between hepato, which is liver, and duodenum, and hepatogastric is between liver and stomach. Then we have ligaments of with walls of abdominal cavity. They are falciform ligament, ligamentum teres, coronary ligament, right and left triangular ligaments. The falciform ligament contains the ligamentum teres and remnants of umbilical vein. This coronary ligament, the anterior and posterior folds of coronary ligament unites and forms right and left triangular ligaments. So the next objective is lobes. The liver is covered by a fibrous structure known as Glissen's capsule. It divides the liver into right and left lobe. This right lobe again divides into two accessory lobes. They are caudate lobe and quadrate lobe. This caudate lobe is upper aspect of visceral surface, whereas quadrate lobe is the lower aspect of visceral surface. The caudate lobe lies between inferior vena cava. It lies between inferior vena cava and fossa produced by ligamentum venosus, whereas the quadrate lobe lies between gallbladder and fossa produced by ligamentum teres. And both caudate and quadrate lobes are separated by porta hepatis. This porta hepatis transmit vessels, nerves, ducts in and out of the liver, except for hepatic veins. Our next objective is blood supply. We have hepatic artery, hepatic portal veins. Hepatic artery supplies non-parenchymal structures of the liver, and it is derived from celiac trunk, whereas hepatic portal veins supplies liver with partial deoxygenated blood. It supplies liver parenchyma and allows liver to perform detoxification. And also hepatic veins open into inferior vena cava. Next we have nerve supply. So nerve supply, we have a hepatic plexus which innervates parenchyma of the liver, and this hepatic plexus contains sympathetic and parasympathetic nerve fibers which Sympathetic nerve fibers contain celiac plexus, and parasympathetic nerve fibers contain vagus nerve. And this celiac plexus and vagus nerve enter into the liver through porta hepatis, which follows the course of hepatic artery and portal veins. That's all about the nerve supply. Next, we come to the last portion of the objective, that is lymphatic drainage. Lymphatic drainage, there is anterior lymphatic drainage and posterior lymphatic drainage. Anterior lymphatic drainage is to hepatic lymph nodes, which then empty into colic lymph nodes, which then drains into cisterna chyli. Next, posterior lymph drainage is to phrenic and posterior mediastinal nodes. Thank you guys.